The wars in Iraq and Afghanistan are taking a mental toll on veterans.
More and more soldiers returning from war are being treated for post-traumatic stress disorder. And Fox 11's Mark Leland is on special assignment this morning, looking at why the number of veterans diagnosed with PTSD is rising.
The stresses of war that linger in a veteran's mind can be troublesome and debilitating. Many relive traumatic events. Others avoid situations that might be a reminder of war. For others, war has changed their outlook on life toward the negative, while the lingering stress has some unable to sleep or concentrate.
I had insomnia, bad dreams. I was short-fused with people. I would get in fights all the time.
I spent a year in a war zone. People were trying to kill me. And I had to be prepared to kill other people if necessary. And that isn't how I was designed. I wasn't designed to do that as a human being. I wasn't designed for that.
These veterans are part of the Veterans Administration's online campaign to help identify and treat servicemen and women who suffer from post-traumatic stress disorder, or PTSD. According to the VA, it is a condition that has been diagnosed in up to 30% of veterans from the Iraq and Afghanistan wars. It is treated with counseling and medication. And the number of veterans diagnosed with PTSD continues to grow. It wasn't until after the Vietnam War that PTSD was even recognized as an actual psychiatric syndrome by the Veterans Administration.
It is a big problem.
Denver Johnson heads up the medical health team at Green Bay's VA clinic. For years, he has witnessed the number of patients suffering from PTSD rise. Nationwide, from 2002 through 2012, more than 256,000 veterans who served in Iraq and Afghanistan have been treated for PTSD. Official numbers for Wisconsin veterans were not available. And the numbers, Johnson says, continue to climb as time away from the war zone passes.
And we're starting to see that rate of diagnosed PTSD increase over time.
Dave Barron from Northeast Wisconsin served in the Navy during Vietnam. He says while PTSD wasn't diagnosed back then, that doesn't mean it didn't exist.
When we came out of our war, in the wars before that, if you had issues bothering you, you didn't say nothing because you had to go to the psychiatrist, and you sucked it up and you found a way to control it, hide it, or you dealt with it the best you could.
Many of Barron's fellow veterans from Vietnam are receiving help now, adding to the numbers being diagnosed. But the shock of war isn't the only thing triggering a rise in numbers. In talking with health professionals, they tell me there are other factors.
The poor economy and the high unemployment rate may be contributing to the increase in numbers that you're seeing here.
I think that's fair to say, yes.
I mean, so
because those are stressors, and any increased stress reduces one's overall ability to deal with stress.
And that is contributing to the rising medical costs associated with treating our veterans. The government estimates the treatment cost for those Iraq and Afghanistan veterans so far has topped $2 billion just for the treatment of PTSD.
Those numbers are a big part of the reason this $60 million Veterans Clinic in Green Bay opened its doors. The mental health staff alone went from 10 in the old clinic to 21 here.
There's been a growing need over the last several years, again, especially with the protracted wars in Iraq and Afghanistan. And so as that need has grown, we have responded by opening this new clinic.
Veterans from around Northeast Wisconsin are pleased with the expanded clinic, one of the largest VA outpatient clinics in the country. Many turned out earlier this month for the ribbon cutting, but some veterans say the opening is long overdue.
It has been a burden for a lot of veterans in the area because they didn't advance, they didn't build a clinic soon enough.
It has been a major burden, and some will say, well, I don't want to go all the way to Milwaukee, and maybe for a simple blood test.
The new facility off University Avenue will now be able to treat roughly 95% of area veterans' medical claims. That will be possible with a larger staff and more resources. Earlier this month, President Obama spoke to disabled veterans at a conference in Florida. He said more funding would be made available to better understand and treat PTSD.
Prevent, diagnose, and treat mental health conditions like TBI and PTSD, and to get it done, we're moving ahead with more than $100 million in new research.
Johnson says the larger numbers of veterans seeking help for PTSD isn't a sign of weakness, it's a sign of better understanding on the part of the medical community and the veterans themselves.
And it's not that the veterans need more care these days. We have we're recognizing at a greater depth what their needs are and opening our doors, I think, wider.
And the greater understanding of PTSD is why the Veterans Administration continues to reach out through its About Face internet campaign. It shares the stories of not only the newest veterans with PTSD, but those who have suffered quietly for decades in the hopes of getting treatment for all who need it.
I never talked about it. I just try to deal with my life because it was supposed to be a man, you know, stop whining, you know, just do your thing, get a job, get married, you'll be all right. Well, that's not what happens.
Last year, the old VA clinic in Green Bay treated over 1,500 veterans for various mental health issues. Johnson expects that number to climb to over 6,000 in the next several years. For Fox 11 on Special Assignment, I'm Mark Leland.
The Veterans Administration is working hard to reach out to veterans who may be suffering from PTSD. They've collected many interviews with veterans, and you can check them out by going to fox11online.com and look for the link in Mark's story.